one Malawi, one people and one nation. I beg to move, Madam Speaker.
It is almost 24 years since countries committed to the 2015 Abuja Declaration to health sector. And over the 24 years, other countries have managed to increase their budget to health sector at least 15% of their national budget. Malawi, it was once within the 24 years, that was in the range of 2012 when Malawi increased the health budget 15%. And we as civil society, we have been pushing government, advocating to government to at least to maintain the 15% of the national budget towards the health sector. Through the advocacy over the years, in 2019, African leaders converged at the AU Summit to start discussing again, reaffirming their commitment of the 2000 Abuja Declaration, 50% of the national budget to health sector. So almost 5 years now since that renewed commitment. And I'm happy to report that through that renewed commitment, Malawi is one of the countries in African Union at the moment in the 2024-2025 national budget, where it has increased this budget to 12.2% of the national budget, which is an upward increase because over the years, Malawi budget has been less than 10%, which was a concern to not only for Malawi, but also to the global commitment for Malawi to sustain health financing in Malawi. So with that, as a civil society organization, Health and Rights Education Program, we embarked on a rigorous campaign in the last 5 years to influence government to start now upward increase of national budget. And we have done so many campaigns, so many lobbying meetings with the Member of Parliament, Minister of Finance, Minister of Health, and other key stakeholders, the youth and civil society, to have this increase. So this year on, we have a 12.2%, which is a 5% point increase from the previous last year of 2023-2024, 8% of the national budget. So we are proud this year as an achievement. And currently, even at the African Union level, Malawi is being attributed as making progressive reiteration of 2019 reaffirmed commitment of increasing the health budget to 15%. So we are happy to report, and we want to urge government of Malawi to continuously increasing the health budget because the needs of the health sector are increasing, but also with the donor fatigue, because most of the health donors are not providing resources as before. So we take this as an achievement or a win to the advocacy which we have done over the 24 years, making sure that we have an increase of the health budget.